Hello everyone, our group research is the impact on science communication on public perception of COVID-19 vaccines. And our group member have Li Yiwen, JIAQIAN, Deng Lulu, Huang Jiayu, Wang Han. First, title. Our group was divided into how clear, accuracy, and reliable message can shape public attitude towards vaccination during a global pandemic. So why does this matter? Because the way we talk about vacancies, whether through the media, public health campaign, or social experts, can make a huge difference in building trust, addressing fear, and encourage people to make informed decisions. It's a topic that sits right at the heat of public health and effective communication, especially during a crisis like COVID-19. Second, problem statement. Science communication has been crucial in shaping public responses to COVID-19 vaccines. And during the pandemic, the repeat space of misinformation, especially on social media, increased fear and skepticism about vaccines. This research focuses on understanding how science communication can counter misinformation, building public trust, and encourage higher communication rates. Like for example, during the initial rollout of COVID-19 vaccines, misinformation about vaccine safety and side effects led to hesitancy in many communities. In contrast, countries that implement clear and consistent communication strategies, such as New Zealand, saw high level of public trust and vacancy uptake. By examining such real-life cases, this research aimed to identify which communication methods are most effective in increased vacancy acceptance. It will explore how different channels, such as traditional media, social media, and community outreach, can be leveraged to ensure accurate information reach the public. In a time when misinformation can spread faster than the virus items itself, understanding the impact of science communication is crucial. This research seeks to provide actionable insight into how science healthy messages can be crafted to foster a more informed, trusting, and proactive public. And finally, enhancing the effectiveness of coordination campaigns. So let's talk next part.
Hello, my name is Deng Lulu. I'm going to talk about literature review, and I will talk this from 4 parts. The first one is prior works. About prior works, there are only 6 parts of it. The first one is vaccine hesitancy is widespread worldwide, including the United States, the United Kingdom, France, and other countries. This phenomenon refers to the hesitancy or refusal of some people to receive vaccines, which can reduce vaccination rates and spread disease. The second one is complex causes of vaccine hesitancy. Vaccine hesitancy stems from a variety of factors such as concerns about the safety and efficacy of vaccines, mistrust of the healthcare system, misinformation, personal values, and cultural background. For example, some people refuse to vaccinate because of side effect concerns or because they are influenced by false information. And the third one is multiple influences on public confidence in vaccines. Public confidence in vaccines is influenced by policy transparency, government communication, and media coverage. In addition to scientific evidence, transparent government and effective communication from scientists are particularly important. The third one is the importance of vaccine communication. Effective communication increases vaccination rates and public trust. Strategies include providing accurate information, responding to concerns, and communicating transparently. Transparent communication, even if it involves negative content, can increase trust, but vague information can be counterproductive. The next one is impact of uncertainty communication. The effectiveness of uncertainty communication depends on the audience. High uncertainty may reduce the sense of self-understanding, but increase actual understanding, while low uncertainty increases acceptance. Strategies need to be tailored to audience attitudes. The last one is communication challenges for scientists. Scientists need to balance scientific accuracy with effective communication. Simplicity increases trust, but overemphasizing uncertainty can lead to mistrust. Okay, next, I will talk about current trends. There are 4 trends. The first one is interdisciplinary and cross-cultural research. Research involves medical, public health, sociological, and other disciplines, as well as different cultural backgrounds. Interdisciplinary approaches facilitate comprehensive understanding, and cross-cultural comparisons reveal similarities and differences in the effectiveness of strategies. The second one is individual and group differences research. Research focuses on individual differences such as political attitudes and conspiracy thinking, and the communication needs of specific populations such as different ages, genders, levels of education, and healthcare workers to inform the development of crisis strategies. The next one is new technologies and dynamic adaptation. With the help of social media and big data, researchers analyze public attitudes and dynamically adapt communication strategies in response to outbreaks and social feedback. The last one is focus on long-term results. Moving from short-term vaccination goals to long-term trust maintenance emphasizes the long-term benefits of transparent communication, such as building a foundation of trust for future health crises. And then I will talk about some research gaps. There are 7 gaps about this. The first one is long-term trust and vaccine hesitancy. There is a lack of research on the impact of vaccine hesitancy on long-term trust in the public health system, especially how it translates into short-term crisis of trust. The second one is assessment of the effectiveness of communication strategies. Existing research is limited in assessing the actual effectiveness of different strategies, and more empirical research is needed to optimize strategies. The next one is cultural and social context differences. Vaccine hesitancy and effective communication strategies are understudied in different cultural and social contexts, especially in developing countries and multicultural regions. Then social inequality and vaccine hesitancy. The relationship between vaccine hesitancy and social inequalities, such as economic and educational inequalities, is understudied, and there is a need to explore how to reduce inequalities to decrease hesitancy. The next one is longevity of communication effects. The long-term effects of transparent communication and negative disclosure are under-researched and need to be explored for their durability in addressing emerging health challenges. The next one is attitude and behavior transformation. Much of the research focuses on attitudes and intentions, and there is a lack of exploration of how to translate positive attitudes into actual inculcation behaviors. Finally is the dynamically adapted strategies. Research is needed on how communication strategies can be adapted to maintain trust and willingness to vaccinate in response to outbreak developments and public feedback. The last one is the references that have been searched.
Hello, I'm JIAQIAN, and I'm going to explain the research question from three perspectives. Part 1, background from literature review. Part 2, central research question and the research sub-question. Part 3, research gap and significance. Our research revolves around a key question in public health communication. How does science communication influence public awareness and acceptance of COVID-19 vaccine? Then, the part 1. Background from literature review. These research questions stem from observation made at several key points in the literature review. As LULU said in the literature review, hesitation about the vaccine is a universal phenomenon in the world, including developed countries, such as the United States, the United Kingdom, and France. The complexity of the issue stems from a number of factors, including concern about vaccine safety, distrust of the healthcare system, misinformation, and different cultural backgrounds. Next, we are moved to part 2, central research question and research sub-question. Our central research question was how does clarity, accuracy, and relevance of scientific information influence public attitude toward COVID-19 vaccination during a global pandemic? This overarching question is supported by three specific sub-questions. Question 1. How do different communication channel and strategy affect public trust and understanding of COVID-19 vaccine information? Question 2. What role does transparency play in communicating scientific uncertainty, in shaping public confidence in COVID-19 vaccine? Question 3. How can science communication effectively address vaccination hesitancy and maintain public trust in the healthcare system? Then, follow the third and final part of the research question, research gap and significance. According to the literature review, where peer studies have extensively examined hesitation regarding vaccination, there is a limited research on how different modes of communication affect public trust. During the rapid development and deployment of a vaccine, as noted in the literature review, despite the substantial scientific evidence of safety, public concern about the vaccine remains strong. This suggests that our study aimed to address a critical gap between scientific evidence and public perception. At the same time, we know from previous research that transparency in government and science communication is critically important. However, uncertainty remains about the optimal balance between acknowledging scientific uncertainty and maintaining public confidence. Therefore, our research question aims to fill the gap in the area by examining how different approaches to communicating uncertainty affect public trust and vaccine acceptance, and can provide an actionable insight in improving science communication strategy. We can develop more effective ways to bridge the gap between scientific evidence and public understanding. By understanding how different modes of information dissemination affect public perception. I think this is all. This is my part.
Hello everyone, I'm JIAYU. It is a pleasure to share with you the objective of our recent research,
which focuses on a crucial and timely issue, the role of scientific communication in shaping public trust in COVID-19 vaccines. Our study is driven by three primary objectives. First, understanding public perception of vaccine safety and efficacy. We aim to investigate how scientific communication influences public's perception of vaccine safety and effectiveness. We aim to investigate how scientific communication influences the public's perception of vaccine safety and effectiveness. In an era of widespread information, no, maybe say unfortunately misinformation, it is crucial to understand the factors and build a erode the public confidence in vaccines. Second, analyzing communication channels. Communication is not a one-size-fits-all process. Different platforms such as social media, traditional media, and direct public health messaging have varied impacts on how vaccine information is received and interpreted. We explore which channels are most effective in ensuring accurate information research the public. Third, reducing vaccine hesitance and countering misinformation. Lastly, our research examines how scientific communication can character misunderstandings and reduce vaccine hesitance, can character by identifying strategies to address misinformation and increase public awareness. We hope to contribute to more effective public health campaigns and ultimately higher vaccination rates.
Hello everyone, my name is Wang Han and my measuring number is 23098730. Next, please allow me to talk about methodology, which includes research design, sampling and respondent, research instrument, pilot test service, and data analysis method. First is research design. This study adopts a quantitative approach by meaning of surveys. Data and information received from questionnaire question distribute. This approach is necessary because it reflects and respondent position well. The questionnaire will consist of 5 parts and will be conventionally distributed to 100 Chinese students enrolled in UM. In this session, the participated answered 5 to 10 questions. Next is sampling and respondent. This study was conducted with 100 Chinese master students creative enrolled in the Faculty of Science at University Malaya. The respondents consists of students especially in science communication and public engagement, chosen due to the significant similarities in their living environment and shared experience. The third is the research instrument. In this process, 100 respondents will receive a questionnaire including 5 parts A, B, C, D, and E. Section A is demography, which mainly includes gender, age, grade, family income, entertainment method, and so on. At the same time, this part is closed questions. Respondents are required to choose an answer from the given answers, usually single choice. In addition, B, C, D, and E are determined in part by research question and research objective. These parts use the left scale to display. The numbers from left to right are 1, 2, 3, 4, and 5, representing strongly disagree, partially agree, and strongly agree respectively. The fourth part is the per-text surveys and pilot test. This part is mainly used for preliminary testing before the formal questionnaire is issued. The purpose is to find programs in the questionnaire and create them in time to avoid more program after the formal questionnaire is issued. Among them, the final result between 0.7 and 0.9 indicates highly reliability. At this time, the formal questionnaire can be issued. Finally, we need to analyze the data. The main tool for data analyzing is the SPSS data analysis system. After all the questionnaire is collected, we will get 100 pixel data. After importing this 100 pixel data into the SPSS data analysis system, we will conduct validity analyzing, correlation analyzing, and so on. Data between 0.7 to 0.9 is considered valid. That's all about the impact of science communication on public perception of COVID-19. Thanks for watching.